Good afternoon, everybody. Afternoon, Rachel. It's 4 o'clock on Monday. We'll come to you 3 times this week so that we can all remember that we will get through this and we'll get through it together. Today, we're going to give you a lot of information on the positive direction many of our numbers are going in COVID, both nationwide, but we'll talk about here in Kentucky. We'll go over more vaccine information. Remember, we are vaccinating people faster than we get doses from the federal government. If you're having a hard time signing up, it's because there just aren't enough doses. But we are working hard, and everybody is going to get their turn. But let's start out with some of our news of the week and good news of the week. So it's February 1st, which means it's the beginning of Black History Month. And I believe that in Black History Month, we need to not only look back on our history, but also try to correct some wrongs that occurred in it. So a year ago, during Black History Month, I posthumously promoted Colonel Charles Young to the rank of Brigadier General in the Kentucky National Guard. Colonel Charles Young is a native Kentuckian who was born into slavery in 1864. He went on to become just the 3rd Black graduate of the United States Military Academy at West Point and the first Black military attaché to a foreign country. Colonel Young remained the highest-ranking Black officer in the United States Armed Forces from 1894 up until his death in 1922. I truly believe his service to our country was invaluable. And but for the racism of his time, Colonel Young would have been properly promoted to the rank of general. He would have been the first Black American to do so. And we would have had the pride of that individual coming from our great state of Kentucky. I wrote to President Biden on Friday, asking that Kentucky National Guard Brigadier General Charles Young be granted the honorary title of Major General in the United States Army. Now, this was an important thing to do, brought to me by so many others actively serving in our armed forces who had. And it was shortly after that we did this that I was in D.C. Walking through the African American History Museum and ended up right in front of the exhibit on Colonel Charles Young, someone who brings so much honor to this state. And I think it's time that we work to make sure he gets the honor that he is due as well. So as we strive to end racial injustices that persist to this day, we must recognize the contributions of those like Charles Young to the successes and the freedoms that we all enjoy as Americans. He's more than deserving of this rank, and I support his promotion to Major General. I'm hopeful this new administration will grant our request to honor Charles Young's service to our country. All right, the next piece of good news is we've talked about jobs of the future. We've talked about some exciting new developments. We specifically talked about a company called AppHarvest. AppHarvest opened the largest greenhouse in North America, one of the 10 largest buildings in the world with the most sophisticated LED lighting system I believe has ever been created this year. And they've just provided their first crop of tomatoes to grocery stores all across the East Coast. But today, they did something really exciting, and that they became a publicly traded company. That's right, from right here in Kentucky, from Moorhead, Kentucky. And they were featured today ringing the NASDAQ bell to open up the market. I want to give you a look at this great day, not just for this company, but for us in Kentucky. The newest publicly traded company that rang that bell on the NASDAQ, something that everybody looks to, was from right here in Kentucky, homegrown. This is it's pretty special. Take a watch.
On behalf of everyone at AppHarvest, we would like to thank the NASDAQ team in making today possible. This marks a major milestone in being able to achieve our overall mission to sustainably grow fruits and vegetables at an affordable price for every American. Utilizing technology and infrastructure, we can build systems to grow a fruit and vegetable with 90% less water, getting 30 times more yield per acre, getting the harsh chemical pesticides out of the growing practice, and not using genetically modified seeds. This is critical as we all move forward to build a global food system to meet the rising demands. The UN has predicted by 2050 we would need up to 50 to 70% more food to meet a rising population and growing middle class. And it can take up to 2 planet Earths to grow food the way we currently grow it to produce the amount we need in 2050. Right now, I'm standing inside of our flagship facility in Moorhead, Kentucky. Nearly 2.8 million square feet under glass will produce up to 45 million pounds of tomatoes annually. We've set a target to build 12 facilities by 2025. We believe it is critical that we bring fruit and vegetable production back to the U.S. And here in the heart of Central Appalachia, we can get to nearly 70% of the U.S. population in a one-day drive. I'd like to thank our partners, our investors, our board members, community members all across the region, and the AppHarvest family who've helped make this possible. Together, we will rebuild a global food system that puts people and planet first. Appalachia, let's grow.
So a pretty exciting day when one of the markets started with a great story, a great company from Kentucky. We're committed in this next year to find the next AppHarvest and the next one after that and the next one after that. And because we've got a chance right now to compete for the jobs of the future, there's a lot of excitement out there. And when we stop doing silly stuff, when we stop fighting with each other, and when we focus on the future, there's so much we can do and so much potential here in Kentucky. All right, a couple other housekeeping things. By official order, I've extended the option of renewing or replacing standard issue driver's licenses by mail or drop box with local circuit clerks. It applies to licenses that have expired or will expire by June 30th, 2021. If the standard license is your preferred card version and you qualify to renew or replace it remotely, I encourage you to do so. That's a way to reduce in-person contact, and that's how we help to stay safe during COVID-19. The forms you will need can be downloaded from the website of the Kentucky Court of Justice. That is kycourts.gov. Not every license qualifies for renewal. For example, if you require driver testing by the Kentucky State Police, you're going to have to apply for that in person. If you've had a change of address or your name's been legally changed, you must apply in person. Real ID licenses must be applied for in person. We're continuing to offer essential in-person services, but when you can renew through the mail, through a drop box, without having to have that person-to-person contact, you should. This order only focuses on driver's license, not vehicle registrations. There is no more extension at the moment for vehicle registrations. Also, pretty important today, we have extended the mask mandate. Again, absolutely critical that we all wear these. And as you'll see when we talk about our COVID numbers, they are working. To lift this mandate now would leave us vulnerable at a time that we can see the light at the end of the tunnel and where we are headed for victory. We cannot let that happen. So continue to mask up. It goes for another 30 days, but we're going to be wearing these until enough people in the Commonwealth have been vaccinated to where we can protect the most vulnerable. With that, I'll turn it over to our Lieutenant Governor on our continued push to get broadband, high-speed internet to every single house in Kentucky.
Thank you, Governor. Speaking of jobs of the future, as you know, our administration is committed to bringing broadband internet connectivity to every home in Kentucky because closing the digital divide is critical for economic development, for education, and for creating those jobs of the future. So 2 weeks into our speed test, I'm happy to report that 44,000 households have participated so far. And that's great news. To give you an idea, in just these first 2 weeks, we have actually outpaced states who have had their speed test going for longer than 6 months. So that's really impressive, but we, again, need to keep pressing forward and get as many folks involved as we can. The counties with the highest participation rates so far are Scott, Harlan, Caldwell, and Lyon counties. On the opposite end of the spectrum, we need you to help us spread the word in counties, McCreary County, Meade County, Elliott, and Owsley counties. And I'm going to impress upon you again, we need everyone, no matter where you're from, to participate in this, because this speed test is the first step to bringing internet connectivity to every Kentuckian. It takes 30 seconds and it is completely anonymous. We'll take this data and we'll build a map of Kentucky highlighting the areas that are in most need. And once that mapping is complete, we will work with our partners, both public and private, to bring fast, reliable internet connectivity to the areas that are most in need. So one last time, please visit speedtest.ky.gov to take this test. Thank you so much, Governor.
I heard Elliott County in there. I take it Rocky's in trouble. All right. We want to make sure, even if you're in those counties, it's mentioned just because we need your help. We want you to have that high-speed internet just like everybody else. The more people that do this, the better our map will be, and the more people we will ensure that we can get that fiber to the house, that high-speed internet. We all want this to be really successful. So please do your part. And thank you to the Lieutenant Governor, the Education and Workforce Development Cabinet for doing a great job and pushing it. And take that to all the states that we've already passed in just a couple weeks that have been at this for a ton of months. Yes, we're competitive. All right, let's turn to our COVID report, and let's start with our stair-stepper chart. Let's start with good news. The trend on new cases, new weekly cases, continues to move in the right direction. We have now had 3 straight weeks of decreasing numbers of total cases. Folks, that's only happened twice in this entire pandemic. Just about every time that we have had a surge, think about it, we've had 3 major waves. We have stopped it, but it's primarily plateaued. What we are seeing both in the state and in the country right now isn't a plateau, it is a decrease. And as you look at it, it's a significant decrease. Now, we've got to make sure that we admit and we feel that we are still at a dangerous time, because if you compare last week even to the summer in the pandemic, we have a lot of cases, which means we're going to have a lot of people who we lose because of those cases. But 3 straight declining weeks for only the second time in the midst of this pandemic is a real positive sign, and we want to see these cases continue to fall. We have a graph on positivity rate. Again, we're seeing the same thing here. It's not quite as dramatic, but it shows you, especially after this last surge, that we have seen our positivity rate decreasing. That shows you that our decrease in case numbers isn't because of any change in testing. There is less disease out there, or fewer people by percentage are getting the virus week over week over week. And as you'll see today, we are under 9% for yet another day. So cases are decreasing, positivity rate are decreasing, so are the number of people in the hospital. Let's look at the inpatient census. We are now seeing, as you see, that graph went way up, which was our major concern, and then it leveled out, and now we're starting to see a real decline. Today's numbers continue to bear that out. And more good news, the ICU numbers continue to decline. And again, we got to put this in context, right? They're a lot higher than they were in the summer or back when we were doing healthy at home. But with everything we've been through and the country's been through, I think seeing a decrease, hopefully being optimistic that it will continue, but remaining vigilant is where we should be. What it should tell you is when you follow all these good practices, when you wear a mask, when you remain socially distant, we see results. We see results in people being protected, fewer people getting the virus. And what that means is a month or 2 from now, we will see fewer deaths. You're doing your part to save lives. Ventilators also down from what we have recently seen. I think we have just a couple of extra people today as compared to yesterday. When we look at our hospital capacity map by region, today we have 4 regions in the red. all because of ICU capacity. But when you look at areas close to them that can help these regions, you see really fairly low ICU numbers of individuals, percentages of ICU beds that are full. So thanks to your work and thanks to a lot of tough steps we had to take, thanks to the sacrifice of things we did November into December, we have for the moment preserved our healthcare capacity. We did not end up where Florida and Texas and Arizona did in the summer, which was in many instances bringing in morgue trucks. We didn't end up where North and South Dakota were in this fall, where they did the same. We're not where LA County was, which I think had 88 different refrigeration trucks at one point. You know, each time we've stepped up to do the right thing. And folks, it's isn't over. We may face another increase before we get through this. And we got to make sure that, given that we have known how to stop it 3 straight times, we don't do something silly and remove our ability to do what works and what's worked 3 straight times. Again, right now we are in a difficult time with a lot of loss, but we've been more successful than virtually all of our neighbors and most of the rest of the United States. When we look at today's numbers, today we are reporting 1,623 new cases of COVID-19. That's up a little since last Monday, but last Monday and today are significantly lower than what we have seen really for the past several months. And our Kentuckians currently hospitalized, 1,314 is down. Currently in the ICU, 337 down. Currently on a ventilator, it's up about 178, but overall those numbers are down from what we have recently witnessed. Our current positivity rate is up 0.04%, which, you know, statistically I'm not sure is significant, but it remains below 9% again at 8.85%. We're now over 4 million total tests. I mean, we have 4.4 million people in Kentucky. We've administered 4 million tests over the last less than a year. I mean, these tests didn't exist until we started working this problem. And now the ability to do that is an incredible testament to so many across Kentucky. New cases by county: Jefferson 284, Fayette 114, Madison 111, Davis 83, Kenton 58, Warren 51. The rest are all under 50, and they can be found on kycovid19.ky.gov. I haven't provided race and ethnicity updates. They've been on the website, but we've seen significant movement from where we were in the summer, when especially our Black Kentuckians were dying at twice the rate that they make up the population, to certainly a better place. And I think it's thanks to a lot of leadership, a lot of interventions. Right now, when we look at deaths by percent, it is our white Kentuckians make up 87.81%. Black Kentuckians make up 8.78%. So just slightly over percentage of the population. When we look at multiracial, 2.72%, and everything else is below 1%. Our Hispanic population only makes up 1.83% of our deaths here in Kentucky. We do have more deaths, though, today and continue than we want to see. We're reporting 35 new deaths. This is, again, the result of that exponential increase that we saw, and certainly the post-holiday bump. Today's 35 include an 88-year-old woman from Adair, a 67-year-old man from Boone, a 69-year-old man from Boone, a 71-year-old man from Boone, a 56-year-old man from Boyle, a 72-year-old woman and an 89-year-old woman from Bullitt, and 4 men from Bullitt, ages 78, 79, 81, and 81. 67-year-old man from Callaway, 76-year-old man from Clay, 74-year-old woman from Clinton, 3 Fayette Countyans, a 97-year-old woman, an 87-year-old, and a 94-year-old man. 79-year-old woman from Grayson, 81-year-old woman from Harlan, and a 60-year-old man from Harlan. 60-year-old man from Harrison, 45-year-old woman, and a 78-year-old woman from Jefferson. And then men from Jefferson ages 59, 67, 71, 77, 78, 79, and 95. 68-year-old man from Kenton and a 79-year-old man from Kenton. 90-year-old man from Lawrence, 88-year-old woman from Madison, and a 68-year-old man from Monroe. And for the first time, only 6 individuals from here right now, we believe, were in long-term care. I hope that's a sign that our early vaccinations and steps in long-term care are making a difference. But again, it should be a warning to all the rest of us. This can impact you whether you are in a long-term care facility or not. Update on our last week experience in schools. We had 1,330 students, K through 12, test positive last week, and 563 staff members. Newly quarantined students last week, 6,886. Newly quarantined staff, 911. I think we currently have 18 high school sports teams that are quarantined. Long-term care, 576 total residents, which is 18 new that have active cases, 30 new staff members, 9 new deaths attributable to long-term care. Again, the growth there as our overall percentage of deaths, it's not growing. It's actually now decreasing, which means we're doing a better job, especially as the vaccinations happen. All right, let's move to vaccinations, which will be where we'll go and tell questions. I first want to start by trying to give you a way to view our progress and where we've gone to date from not having the machinery in place as the vaccines were sent to us and then out to hospital for healthcare workers, but without a dedicated infrastructure like the one we are building right now to where we are. So can you put up the chart? What I'm going to show you is the thing that we are really trying to track the closest is how many unique people, how many new people are we getting vaccinated each week in a race to get people vaccinated. The second doses, when they come in, they are for a specific person, and we're going to get them to that person. It may take a little longer than we would normally do in our first dose, but Dr. Fauci, CDC, FDA all say you got to get that second dose to the person. But the real question to how we're doing, I think, is how quickly we are getting a first dose that we get into a Kentuckian's arm, now a newly vaccinated Kentuckian. And so as you can see, the first 2 weeks when we were building this airplane, while we were flying it, and when everything that came in was for long-term care, and remember, we had to give Walgreens and CVS enough for the whole program right away, which in hindsight, I wish they would have planned very differently. And then the hospital systems, it took a little longer than we would have liked to get their vaccines out. But you can see in the first 2 weeks that our process was moving slowly. By week 3, we started humming. And then the last 4 weeks, we have vaccinated more people than we received first doses that week. In fact, if you look at the weeks of January 12th and 15th, we were vaccinating significantly more people than we received doses. What this shows you is how we have been able to build the system, how we've been able to increase capacity over time, and how right now the problem is not that we can't get a dose to someone, it's that we don't have enough doses compared to the people who are currently eligible and certainly the people that want one of these vaccines. And in our regional centers, which we are building out, the goal is to have capacity to do even more than the 250,000 vaccinations we believe we can do right now. And to have an efficient system where in any region, you know where your provider is, you know how you sign up. But that's not to say that there's an appointment available, because that depends on how many vaccines that we have. So we can tell somebody where they'll get it. We can tell somebody how to sign up, but what we can't do is provide a vaccine that we don't have. If we have 3 problems right now, there's supply, supply, and supply, because as you can see from the last 4 weeks, we can distribute them, faster than the federal government can provide them. Overall, you can see we are making up for lost time. We are at an 86% 7-day utilization for really the entire time that we have been vaccinating. We want to be at 90%, but remember, we set the 90% goal after the first several weeks. So I think that this is really good progress. I think this is a transparent way to show you the weeks that we could have been doing better, but also where we are right now. So to continue to walk through this system we're building out, I want to turn it over to Jim Gray, who is our Transportation Cabinet Secretary, but our project lead on this very critical project. Jim?
Governor, thank you, Governor. And you asked me, Governor, to talk about the site that's been stood up at the horse park that will be opening for vaccinations tomorrow. But before that, you asked me to talk about where we are in the full build out across the state of our vaccination sites. And I'm going to ask James, if he can, to pull up the map of the vaccination sites across the state. This is from our website, and what it illustrates is that there are today 34 vaccination sites across the state. Now, more will be announced, but let me say a few things about the focus, where we are today in the focus, and what is really driving these site selections. First is population density, and then equity, vaccine throughput, and then drive time. Now, importantly, what we're talking about in terms of drive time is that the goal is that no one will have to drive more than one county away to get a vaccine. Now, we're not there yet, but that is the goal. Now let's shift over to talk about the horse park and the site at the horse park opening tomorrow, the first regional vaccination, high volume vaccination site. Setups are underway as we speak today. In fact, I just got off the phone with Kroger's project manager at the site. Very optimistic about where things are. Now, that doesn't mean that everything's going to be perfect on the launch, but this is an image of the Alltech Arena, where the first regional site will be located. We will be targeting of course, the entire vaccination project. We'll be targeting upwards of 2.5 million Kentuckians. That's perhaps, and I've said this before, you've heard the governor say it, perhaps the largest logistical challenge project effort in world history. That's just Kentucky, but of course, just in Kentucky, it's 2.5 million. If we take the current 2 doses, you can do the math on that. That's as many as 5 million doses. Now, if our new vaccines are authorized and released, then perhaps less than that will be required. But the project itself, the overall project, build out in the state, will of course involve other sites like the horse park, high capacity regional locations. More on that will come later and this week. But it will also, and this is important, it will also require and involve local community settings, hospitals, our local health departments, ultimately pharmacies, of course. This will allow us to reach those individuals, those most vulnerable, who cannot travel to a regional site. Again, the goal is that no one will have to drive more than one county away to get a vaccine. We're not there yet, but that's where we are headed. The bottom line is that these are all part of a strategic approach to getting this important vaccine into the arms of all Kentuckians who want them. Now, as the governor said, the 3 most important words in this project today are actually constraints. Supply, supply, supply. Vaccine supply remains very tight at this point compared to the demand, of course, for the shots. And that's why appointments for today and the rest of this week at the horse park filled up very quickly. If you're currently eligible for the vaccine, and the governor has said very clearly that we're focusing on 70 and over, our citizens 70 and older. But if you're currently eligible for the vaccine, check the vaccine website frequently to see if more appointments have opened up. Those of you who are eligible, not eligible yet, but who signed up for notifications will start getting updates this week. Now, we all know the difficulty in scheduling a vaccine can be extremely frustrating, incredibly frustrating. But as the governor has said, and I'll say it too, and Dr. Stack has said, in some sense, this is a positive as we go forward, because the fact is that so many Kentuckians are actually wanting the vaccine, and everyone will get their turn. We just ask for continued patience as we ramp up this system. Okay, now let me talk for a minute about some of the questions and some of the about the appointment process itself. Kroger has actually, this is for the horse park for this week. Kroger has reviewed all the appointments that have been made, and every scheduled appointment has a corresponding confirmation number in Kroger's system. Kroger recommends the following if a patient says they have not received a confirmation email. So let me go through this. If you haven't received a confirmation email, that email may have gotten moved into junk email. So check it. Also, I want to remind patients, those who have gotten appointments, that they will be receiving a follow-up confirmation email 24 hours before their scheduled appointment. Now, I also want to ask this as a backup. Just think about it this way as a backup for a system that's just being created and stood up. If you're scheduling for the first time, Kroger recommends that you take a screenshot of the confirmation that's presented upon registration completion and write it down. Write down the time, the date of the appointment. All right, now, just a few reminders about tomorrow for those of you who have an appointment at the horse park tomorrow. First, yes, you do need to have an appointment to get your vaccine. No drop-ins. Now, down the line, there may be opportunities for drop-ins, but not now. Second, bring some identification so Kroger representatives know it's you who has the appointment. And third, when you arrive at the horse park, please wait in your vehicle. Please wait in your car until 5 minutes before your appointment is scheduled, before your vaccination appointment is scheduled. Now, this is really important so that we can maintain safe social distancing inside the building, inside the Alltech Arena. And of course, remember to wear your mask and remain 6 feet away from others as you enter the building. Now, also as a reminder, both security and the National Guard will be on site with golf carts. So if you need help, those who may need help, have difficulty walking or whatever, they'll be available to help you to the entrance. In case of bad weather, there'll be a socially distanced line in the indoor hallway outside the entrance to the vaccination area. Now, there's going to be plenty of signage there, and there's going to be plenty of help to help folks who are getting their vaccination. Now, once you check in and get your shot, you're going to be asked for insurance information. And that's so Kroger can bill your insurance company or Medicare or Medicaid. Now, please don't worry if you don't have insurance. There is no out-of-pocket cost to get the vaccine. Now, finally, once inside, it could take up to a half hour. Now, we hope it's not going to take that long. I've heard of locations where it's not taking that long, but it could take up to half an hour or more to get your vaccine, and then to wait the expected or the required 15-minute observation period after the shot. So again, please be sure to plan on that. And probably can't say this enough, Governor. You said it many times, is please be patient. I think I've covered, Governor, what I needed to about the horse park tomorrow. Thank you, sir.
All right. I will thank Secretary Gray. And just to give you an idea of demand and also what it takes to put up one of these regional centers, I just read that Ephraim McDowell in Danville got 170,000 calls for their first 300 slots of being a regional vaccination center. And so they're putting forms up online and working on the call center side. But this is a huge logistical challenge with an amazing amount of demand, a limited amount of supply, and needing to make it work where we vaccinate people really quickly, but at the same time, try to get the highest priority folks, those that are most at risk, vaccinated as quickly as we can, along with serving other really important societal needs like getting our schools fully reopened. All right, let's move to questions. I know there are some different ones hanging out there. Let's start with Sarah Ladd from the Courier-Journal.
Thank you. Good afternoon. I had two things. The second one is pretty quick, but the first thing is earlier today, the Clark County Health Department in Southern Indiana reported that 25 to 30 people over the weekend had lied or in some way misrepresented themselves to try to get vaccine access and had to be turned away. Are you aware of that happening anywhere in Kentucky? And if so, what's your reaction to that? And the second thing is any news on when Kentucky might start providing demographics on those who've been vaccinated? Thanks so much.
Thank you, Sarah. We hope to be able to provide demographics Monday of next week. We've been able to pull generally age and are finalizing that. We believe we're going to be able to pull racial and hopefully ethnic data too. And so, my goal, and I think we'll be able to meet or exceed that, ought to be on Monday. It's something that we should be reporting and need to be reporting, and we will get to that point. About the issue that Clark County, Indiana raised, it's really important that people not try to misrepresent age or other things to get these vaccines. We have to have an orderly approach of getting these out. And the moment that some people think that other people are cheating, then we worry about the calm that's necessary to get this project and this process finished. My hope is that everybody will live out their values or their faith and be honest and wait their turn in line. We haven't seen a lot of that, but we have seen instances where folks seem to be getting vaccinated, certainly out of order. We think most of the time, though, that is due to not wanting to waste any vial and therefore, dipping just one category down. We certainly now provided direct guidance on the two goals: follow the priorities, but make sure you get 90% of it out in 7 days. Regional centers and online signups ought to address some of that too, to make sure some of what we're seeing nationally, where people who sit on a board of a hospital are getting vaccines out of order. By formalizing this in ways that we are doing, we ought to cut out a lot of that. Is it a concern that we have? Sure, because everybody just desperately wants this, but we need people to be good. We need people to be really good people in these anxious times where they are awaiting the vaccine. A whole lot of it seems like early on in testing, where we asked people who are healthy to wait to get tested when we didn't have enough. We're asking the same now. Tom Latek from Kentucky Today.
Good afternoon, Governor. I've got a two-parter, but it's on the same topic, so it's not that bad. How do we stand on the K through 12 vaccinations? How far along are we? And where do the university and daycare employees who also deal with teaching, if you will, where do they stand in the vaccine priority?
So in K through 12, we will have everyone who wanted a vaccine will have been vaccinated with their first dose by the end of this week. We are on track to be the fastest state to vaccinate our educators, which we believe is going to allow us to, right now, most of our schools do have some in-person learning, but significantly expand that. And that is going to be the expectation. We need to get our kids back in the classroom. And once we've protected those that are in and around the building, we're going to get to do a whole lot more for numerous months that will still remain in that school year. Other states are now doing this because we're now seeing experts say this is what you really need to do to fully open schools. University and daycare are both in 1C. They are just one level down from 1B. That ought to be in the coming weeks. We have seen a greater demand from individuals over 70 that want the vaccine, where originally many were hesitant, but now want it. And so we're seeing a real significant uptick, both in interest from those over 70, but we've done a lot of vaccinations, especially over the last 5 days of individuals in that group and over the next several weeks. So university and daycare, you are prioritized. You are in that next group. We hope to get that group open soon. Stu Johnson from WEKU.
Thank you, Governor. Good afternoon. You began your briefing today talking about African American History Month, and in addition to recognizing Charles Young and the fact that the percentage of African Americans dying from COVID has declined, you have also previously talked about healthcare disparities. In your budget, can you point to something specifically in your budget that addresses healthcare disparities or a separate bill?
It's a good question. Where we have focused in this administration, and we believe it has had a significant impact in the midst of COVID, is access to healthcare, specifically right now, Medicaid. We have been able to open up pandemic Medicaid during the course of this pandemic, where we have signed up so many more Kentuckians that never had coverage or who have lost coverage. And we've seen a significant uptick, especially in our African American communities. We continue to focus working with our healthcare providers, a lot of them hospitals and others, about ensuring that there is also access within these communities, whether it's clinics or others, because you shouldn't have to drive all the way across town or take a bus to get what you need. We do have two pieces in our budget and/or we're working on in our cabinets that impact some disparities in other areas. One is in teaching. We have a specific program where we are pushing to have more African American teachers. You've got really good studies about what a positive impact that has on the students. Also, we have money for a recruitment office in the Kentucky State Police, knowing that, again, we need more diverse police force, certainly on the state police and in others. And we continue to work in the cabinet on a number of different areas to try to address overall health, both in that community and in others. But we certainly had that very targeted marketing campaign. It was called the 1, 2, 3 Free for Me campaign that we believe is a major driver that helped in the course of this pandemic. And we're going to continue to look for all those best ways. I believe healthcare is a basic human right. We got to sign everybody up. Karen Czar from WUKY.
Good afternoon, Governor. You and Secretary Gray have talked a lot about not letting any of these doses go to waste. If some do become available and these locations can move into 1C, what is that window of opportunity and how will people be notified? And also, will we be able to know the success rate of Kentuckians who are returning for their booster shots? Thank you so much.
On the second piece on the booster shots, yes, we're going to be able to provide that. Our goal is for it to be 100%. Right now, the booster shots are really only coming in for long-term care and healthcare personnel. There's a specific program for long-term care, so we believe that'll be right at 100% because they go to them. Healthcare, we have a high degree of confidence that we'll get the second ones. Really, it'll be in this 1B group that we'll start seeing that, and that's really about a couple weeks away. What we'll track, though it's not the primary thing we're showing and judging our success on, is the number of second doses that have been provided, because they're provided separately, and the number of them that have been administered. Again, we don't think that that'll necessarily happen as quickly as the first round because these are specifically designated as second doses. For the larger sites, what we're working on is having digital waiting lists. We also have different groups within a community that we can reach out to when there are extra at the end of the day. Certainly dipping into 1C is a lot easier and will happen more often at, say, our hospitals or our health departments when they're the local partner for our regional centers with the waiting lists that they currently have. As we continue to build this, we will get better, especially digitally, at what we are able to do, how we're able to screen and order people. I hope that we're a couple weeks away from being able to have 1B and 1C sign up for these sites, but 1B is automatically prioritized. That's going to take some work on the digital side, but that would at least get somebody in a queue that is in 1C, that when they open up, we can get in there. We're also working on being able to schedule further out into the future now that we have guaranteed minimum supply for 3 weeks, and that work, that coding, creating that digital infrastructure is happening right now. Melissa Patrick, Kentucky Health News.
Hi, Governor. So a CDC report came out today about the federal long-term care vaccination program. It had a color map on there. Kentucky, less than 40% of staff and between 60 and 79% of residents in our long-term care facilities are being vaccinated. I'm really looking for the exact percentages in these facilities. I think someone's asked for that. And I'm also curious about what kind of communication and outreach strategies the state has employed to get more staff vaccinated.
So our numbers, and we have to get them from Walgreens and CVS, and I'll ask for those again, on residences is much higher than that. We've seen most residents being very interested in it. Staff, the numbers you're giving, while I thought they were a little bit higher on the very first time, are changing dramatically in the second time we go back. We actually visit each facility 3 times, not just 2. And that's giving an opportunity for staff who were originally hesitant. And I don't believe that they were firmly opposed to it. They just wanted to see others get it first, are now much more willing to get it. But we'll work on getting you those exact percentages. Our challenge is it's a program run entirely through the federal government and these 2 chains that we push and work to get more information on, but is not under our direct control. And I've said, if I go back and do it differently, I wouldn't have opted into that program, and neither would 49 other states. But that's the program that we're in. It is the least successful part of any of the 49 states who opted into it, of their vaccination programs. I think they're getting better, but the sense of urgency there just in the same as our sense has been. Shelby Smithson from WKYT.
Thank you, Governor. We are hearing from some people who had vaccine appointments scheduled with Baptist Health in Lexington, but were told due to a change in allocation, those are no longer available. So they've been offered the shot from Baptist Health Corbin, which of course is an hour-and-a-half drive. Now, is that an isolated issue, or should Kentuckians expect that their appointments could be canceled or even moved to a different location as supply remains an issue and more regional sites open up?
Well, you nailed it on the head. It's all supply. And how much we were able to send out to different places all depend on the amount of supply. And as we move into different phases, and there are different requirements to serve the amount of people in those phases, we may have to have different partners. I'll give you, I mean, when we look at the Ephraim McDowell example of having 170,000 phone calls, right? Most of our pharmacy, a specific pharmacy, would have a hard time handling 170,000 phone calls in that region. But it would be, but it is an ideal partner for vaccinating, say, educators in that area. And it's an ideal partner for potentially vaccinating some hard to reach populations or homebound individuals. So different partners are going to be used in different phases, and the amount that we have at any given time but depends both on the federal government and on the objective that we are serving that week. It's not ideal to have to drive an hour and a half. Ideally, we'd be serving the individuals in that region. But remember, we have two goals, and this thing's never going to be perfect. Number one, to vaccinate people in the priority area that we are on. But number two, to get 90% of those doses in people's arm. So if Baptist Corbin has extra that week, heck yeah, I'll reach out, even if it's out of the region, to get it in someone's arm, or please go to the waiting list of where you've got. If you have to dip into 1C, dip into 1C. But this is a system, again, where we're building the airplane while we're flying it. And there's a lot of good news on the operational side of it, meaning none of it's going to waste and all of it's getting into people's arms. But it's frustrating if you're on a waiting list and it's taking a long time. But remember, if you are in that priority area, more vaccine comes out each week. There's going to be a time and a moment for you. But when we don't know exactly how much we're getting more than 3 weeks from now, it's really hard to tell you exactly when you'll get it. But we're working on that. We're working on being able to schedule out, because I believe that people would be happier knowing I have an appointment in 3 weeks versus just not knowing at all. So I think we're getting better and better. Again, those percentages of the first dose, I think, rival the last 4 weeks any other place in the nation. But if you're waiting on your shot, again, I know that doesn't give you a lot of comfort, but what I can tell you is if we're that efficient, it does mean we'll get to you faster. James Pilcher from WKRC Local 12.
Good afternoon, Governor. A non-COVID question, if you may. As you know, the General Assembly, the deadline for bills this session is tomorrow. Yet we've seen nothing introduced on possibly fixing or replacing the Brent Spence Bridge 3 months after the accident and after a month-long shutdown that cost $3.5 to $4 million to fix. What would you like to see the General Assembly do to replace or augment the Brent Spence Bridge?
Well, I think the first step in moving towards that and many other projects is to start addressing the challenges and the insufficiency of our transportation cabinet budget. That's short-term and long-term solutions, but we have so many needs that are out there that our funding is not meeting. You know, this is something that I told legislative leaders I was willing to do last year, and I'm willing to do it now. But you know, we need to have the courage to step up and to get that done. You know, in Northern Kentucky, we still need the local community too, to come together to support one plan and one plan that ultimately we can fund. And I'm not meaning to suggest that there's any one specific one, but what we have seen is until you can get a community fully on board with the plan, which took many years in Jefferson County, it's really hard to get it moving forward. I am proud of the work on the Brent Spence Bridge, on getting it open early and under budget. But overall, we can't meet our transportation needs in the state, and that's before we go into the federal government. But let me give you I mean, a real specific one is right now we're talking about stimulating our economy. Right now, the president and Congress are talking about creating jobs. Right now, I think Senator McConnell and others are negotiating what should be in a stimulus package. How about we do some transportation? How about we build a couple of mega projects that are absolutely critical to our nation's commerce? How about Congress step up and meet its obligations on our interstate system and at least provide significant help on financing a new bridge in northern Kentucky? Again, I've been frustrated like everybody else. The federal government's walked away from these obligations. Chris Otts from WDRB.
Thank you, Governor. Two on unemployment. I'll try to be quick. When you hired Ernst & Young last summer, the rationale at the time was that it would take months to train new state employees to work on UI, and you didn't have time to get them up to speed. As you know, people are still having problems getting someone on the phone. There's not enough phone appointments. Claims are under investigation for months and months. So did you consider back in June or so hiring people for regular state employment so that you would have more UI staff today, or was there something that prevented you from being able to do that? And then secondly, data that states report to the federal government show that Kentucky has been in the bottom 5 states the last few months in terms of the percentage of claims that are timely paid. I'm curious how this happened even with the outside help and what the state is doing to correct that.
So training new hires, it doesn't just take months. It takes us taking our employees in UI, pulling them off of doing claims and putting them on that training. So we would have had fewer people in the short term helping people out to do those trainings over that period of time. And that's why the decision wasn't made, even though we looked at it on hiring additional folks. I think E&Y has done a good job. We may ask them for more help. Certainly, we don't want to be in the bottom 5 of anything. Now, I believe that our numbers are thrown off by the number of fraudulent claims or claims that we cannot prove or verify somebody's identity. There are still claims that there have been zero communications from the claimant asked to prove their identity for the last 6 or 7 months. And what we haven't done a good job of is finally say, okay, that time is up. I think you're going to see that soon. I know some individuals that got 7 letters to their house for people that they've never met that were fraudulent UI claims. We're always working to pay faster and to turn these around faster. We've also got to get those valid claims that have been sitting for far too long done. We're working on it every single day. At the same time, we got new federal plans that come in that also we have to put into action. But our biggest limitation isn't just the number of people. It's an obsolete IT system where we've got to have coders to do the most basic things and to get the most basic information. Joe Ragusa from Spectrum.
Hi, Governor. So going back to the legislature, I mean, they're coming back tomorrow after a couple of weeks off, and obviously they have a few veto overrides to possibly consider. Where are discussions at with those, vetoes that are out there and the possible override votes? I understand that the Senate President and House Speaker have sent you a letter indicating they plan on taking those up.
I learned today that the Senate President and Speaker of the House are unwilling to engage in negotiation or talks before they override their vetoes. It was something that they said they were willing to do. We put an offer on the table. We followed up numerous times about whether it had been seen and whether we were going to meet. And then the day before the session's about to start, we got a letter saying, we don't have time. We're going to override your vetoes and maybe we can talk after. Folks, here's what's at stake. At least 3 of these bills would eliminate every one or the most important of the rules and practices that keep us safe. They would make masking voluntary. You could read what they've done to allow Rupp Arena to be filled up with maskless fans. Those are the types of super spreader events we've been trying to avoid. And so if If their comment is, we're going to override your vetoes no matter what, and maybe we can talk later, I guess mine is, we'll see you in court. I cannot and will not let the health and the lives of the people of Kentucky be put in this danger when we are so close to getting out of this. This would mean that Kentucky has the least ability of any state in the United States to respond to this crisis and protect lives. You look at a state like North Dakota, which at one point had the highest mortality rate in the world because they wouldn't take action. And then they finally did, and cases started going down. What we'd end up is a North Dakota where we would get there and you couldn't take any action at all. I mean, that putting people's lives and health at risk like that, I can't allow that to happen. And I think people out there know that the virus is what opens or shuts things. And if the virus is not managed, we will not only not have the economic recovery that we want, but there'll be a lot more pain and suffering out there. Lee Searcy from WLEX.
Good afternoon, Governor. This is an unemployment question. Many have received incorrect 1099 forms on benefits they say they didn't receive. In one man's case, his money went to an unauthorized out-of-state bank. How is the Labor Cabinet handling these reported fraud cases? And is it true investigators with the Attorney General's office have to get subpoenas to get unemployment records? If so, why?
Well, that second piece would be news to me. I certainly haven't seen a request from the Attorney General's office. Now, there is a lot of privacy information within everybody's claim that there are certain laws that govern too. On the other forms being sent out, there are both, we know, issues of fraud that are occurring. I believe that there was a email that was provided by Amy Cubbage last week. We can provide that to you for people to send to, but there's also a lot of misunderstanding for those that are getting them and they think the numbers are wrong. There is information up on the Labor Cabinet website right now to help people work through that, and we're going to do our best to help people understand what they've gotten. Certainly on the fraudulent side, we're seeing now that a lot of these claims that we worried were people out there waiting aren't. They're people who are trying to game the system, and we didn't approve those claims, thankfully. Now, certainly with the volume, some fraud has occurred, and that's what we're seeing in some of these. So we'll get that specific email to you. Piper Hudspeth Blackburn from the Associated Press.
Thanks, Governor. So my question is regarding vaccination sites. As the state moves into larger groups such as 1C, I know that last week you said that limited supplies is related to, why this state may not be ready for a FEMA center, but given the fact that the goal is to have Kentuckians travel at most one county away for their vaccine, do you foresee a chance or a time where you would need that federal help to set up those centers? And when do you have a time frame or any expectation of when that would be necessary?
So we want and are willing to have a FEMA center whenever FEMA can provide us additional supply of the vaccine, right? So if we end up with, you pick a number of regional vaccination centers, and we only have 65,000 first doses coming each week, if FEMA sets up one, we just divide the pie out that much more. Now, we may have one additional place that people can drive a shorter distance to, but we think we can reach that on the state side already. So we want a FEMA center. We're talking to FEMA about it. I'm talking directly to members of the COVID task force, which we now have a very direct link to, was able to have a good conversation today with many. But the moment that FEMA says we will supply our centers with additional vaccine, we want one. And we've seen the federal partners are pretty good when they set these up. We look forward to working with them. Stacy Case from Fox Nashville.
Thank you, Governor. My question deals with unemployment. Does the state have any benchmarks, either daily or weekly goals for clearing the unemployment backlog? And are there any benchmarks for the private company hired to help?
The private company, I believe, came out with an evaluation of the number of claims they've done. They're not currently under contract, so we wouldn't have any forward-looking ones on that. It really depends for our people on what they're doing. So it could be that they are working on a final decision in a claim under investigation, in which they're basically a judge and have to write a 2 to 3 page letter decision. It could be that they are working on a new claim, which would take a lot less time than that. It could be that they're helping somebody who originally got signed up, had a couple payments, and then had a problem. That is an entirely different task. This system is so complicated and was created to make people quit by making it so difficult in so many ways. Also makes we expect X amount, X day, very difficult in that you're dealing with different situations just about each and every day, and claims with different complexity. You can think about a claim where someone has income coming from different states too. And in that instance, you have to wait for information to come to you. So our goal is that our people come in each day, they work a full day. They help as many people as they can on new claims that they start with the oldest ones. So we are able to get through those. In the meantime, we're working on updating our website and our IT system. We believe that later this month, we will have that done, and that will process newer claims that are filed a lot faster. But our folks, they're working hard. But past cuts of people, and I mean our IT system works on coding created in the 1970s and was installed in the year 2000. That is no way to work your way through a crisis. And we've got to fix this working into the future. It has to teach us the lesson that if you do not keep your safety net healthy in times of plenty, your safety net will not be able to operate at the level that you need in times of difficulty. All right, a final question here from the CJ. As of today, when do we expect vaccines to be available for prison and jail inmates? Right now, we are focused on how the virus can get in. We're working through a program on corrections officers as the first step. That's who we test to try to prevent the virus from getting in as well, with our hope that any of those coming in and out are keeping up good practices and getting whatever protection the vaccine can give about not bringing it into the facilities. But right now, we still have so many folks over 70 to go, and we'll have so many Kentuckians that are at severe risk for various conditions that make them more susceptible to a bad outcome for COVID. All right, I want to thank everybody. Tomorrow, we'll provide another update, and then on Thursday, our update will include an announcement of some more regional centers. Remember, this is a work in progress, and it'll build out and out and out. But take care of each other. Wear your masks. Continue to engage in social distancing. We're going to beat this thing this year, but we got to be really vigilant in doing the right things until everybody can get that vaccine that I know they're desperately waiting on. We'll see you Tuesday at 4.